What is dry socket? Dry socket is also known as alveolar osteitis. After an extraction, if you get premature lysis of the blood clot, this can result in localized painful osteitis, also known as dry socket. It happens in approximately 5% of patients. Dry socket has been associated with several risk factors such as previous dry socket and clotting issues, mandibular third molar area, traumatic and prolonged extraction, poor post-op instructions such as spitting and rinsing within 24 hours of the extraction, poor oral hygiene, uncontrolled diabetes, smoking and alcohol, oral contraceptives, and immunocompromise. Signs and symptoms of dry socket include severe throbbing pain that's localized around the extraction socket. It usually occurs 1 to 4 days after an extraction. It doesn't occur immediately after the extraction because of the high concentration of a substance called antiplasmin, which prevents the breakdown of the clot. It's also associated with halitosis. The socket may be empty with exposed bone, or it may be full of debris and food. Differential diagnoses should be considered if the socket doesn't heal or if there are signs beyond the socket. They include post-surgical inflammation, infection, osteomyelitis, medication-related osteonecrosis of the jaw or MRONJ, osteoradionecrosis, and oral squamous cell carcinoma. Dry socket is self-limiting and spontaneously resolves in 2 to 3 weeks. However, since it's painful, some sort of intervention is still preferred. Furthermore, it can't be treated, but it can be managed. The first step of management involves giving LA. However, the vasoconstriction from LA can reduce the chance of the formation of a good blood clot. Therefore, if the patient can withstand it, this step can be skipped. The next step is irrigation of the socket with saline. This is followed by using a curette to induce bleeding. Then Alvogel should be loosely packed in the socket. It contains eugenol and butambin, which are sedatives, and iodoform, which is an antimicrobial. It also acts as a physical barrier to protect the exposed bone. If needed, the patient can then be prescribed analgesics and mouthwash. Antibiotics are not needed because dry socket is not an infection. Post-op instructions should be given, such as avoidance of smoking and spitting and rinsing. The patient should be reviewed in 2 weeks to ensure that the socket has epithelialized. Thanks for watching. If this was helpful, please like and subscribe and let me know in the comments if you'd like me to cover any other topic.